Hello, and welcome to the 20-minute Cure for Cold and Flu Hand Hygiene programs. My name is Lindsay Lima, and I'll be facilitating your webinar today. I do have a few notes to cover before passing it on to our experts. First, we'll be holding a Q&A with our experts after the session. So if you have any questions, please use the chat box feature and then send them to me, Lindsay Lima, and we'll be sure to answer them. You can access the chat feature by clicking this little speech bubble icon at the bottom of your screen. Second, we are recording this webinar and we'll send it out to you, as well as posting it to our website, that's bunzelcanada.ca, and our YouTube page. We'll also send out our hand hygiene programs guide for more detailed information on setting up a hand hygiene program in your facility. Now, I'd like to introduce our speakers. Today, we are joined by James Arbogast, PhD, Vice President in Hand Hygiene and Public Health Advancements at Gojo Industries, as well as our own David Smith, the Cleaning, Hygiene, and Sanitation Director for Eastern Canada at Bunzel Canada. So now, David, over to you.
Good morning, everybody. Thank you for joining us. And first, we're going to have a look at how cold and flu season actually affects our business. So let's look at a few of the facts. One, absenteeism costs Canadian businesses approximately $1 billion every year, a staggering number. Presenteeism costs Canadian business an estimated $15 to $25 billion per year. Again, staggering numbers. And when one sick worker spends just 2 to 4 hours in the workplace, they spread germs to 40 to 60% of the commonly touched surfaces in that area. So having shared that with you, I'm going to turn it over to my colleague James to talk about the ick factor.
Thanks, David. Hi, everyone. I want to start with the emphasis on how cold and flu spread in a work setting. And the spread is important because cold and flu, like a lot of other organisms that get people sick, survive on surfaces, including hands for minutes. It's been shown up to an hour with cold and flu, on hard surfaces for up to a couple of days, and on soft surfaces, again, for hours. So once they get in the environment, they can survive and then get you sick. We'll talk about the mode of transmission in a second. Interesting findings from where you can find contaminated spaces. And it's the things we touch, right? We touch keyboards, we touch handles, whether it's on a refrigerator or a microwave, and faucet handles. So the places you touch are really important. And that's where hand hygiene and surface hygiene comes in. We'll go to the next slide. We're going to talk about the chain of infection or the mode of transmission. And if I start in the upper right area, it starts with the germs, the organisms that can get you sick, like bacteria, viruses. We'll focus today on viruses. There's a reservoir. Often it's people-to-people transmission is what we're focused on here. Once they leave your body, which in the case of the cold or flu is often through a sneeze or a runny nose, they can get into the environment and then be transmitted to another person, and that person usually, oftentimes, will infect themselves. Their hands are dirty, they touch their eyes or touch food and then eat that food with dirty hands, and that's what causes the illness. And then the cycle continues from that next sick person on. But luckily we can break that chain of transmission. You want to make sure, and it's really, again, it's not too surprising. Good hand hygiene and good surface cleaning and disinfection is what can get out the germs that are out in the environment. And then if you do get them on a surface, they can remove those, kill the cold and flu, or wash it down the drain in the case of a good hand wash. I'm going to emphasize hand hygiene in the talk today. But whatever you're using and emphasize hand sanitizing, whatever you're using to disrupt the chain of transmission, you want to make sure the products are safe, they work, they kill the organisms, and I would encourage you to ask for data, look for that data from the manufacturers, read the label, challenge them to provide the evidence that it actually works against the organisms that you want to not get you sick, and then they want to be good for you. So safe, effective, and good for you. We're going to transition now into some outcome data. If we go to the next slide, we've done a lot of studies around hand hygiene and the role it can play in reducing infections or reducing absenteeism due to infections. So this slide we summarize a multiple different, what we call outcome studies. They're typically a intervention like hand hygiene in the elementary schools, the schools with a hand sanitizer that were studied versus a control group without a hand sanitizer. Schools that have been shown to have 20 to 50% reduction in absenteeism due to illness, preventable illness. Healthcare, there are two studies mentioned here, reduction in infection rates, but there are literally hundreds of studies that support alcohol-based hand sanitizers and hand washing as the most important means to reduce illness and infections. The CDC has a guideline, Health Canada has a guideline, and the World Health Organization has a guideline that strongly recommends alcohol-based hand sanitizers. And then we've got education facilities, universities, military, et cetera. And this, if reducing absenteeism is really important. It affects productivity, it affects the quality of your performance in the office place. And it can reduce it on average by 25%. Okay, if we go to the next slide, I want to talk about one specific study that's really unique in the sense that this was done with an insurance provider. So Medical Mutual of Ohio is a large insurance provider in the United States, within the top 15 in terms of size. And the study, I was part of this study. We collaborated with them to put an intervention in place that consisted of a hand soap throughout a good quality hand soap at the areas where you wash your hands at the same, alcohol-based hand sanitizer, and hand sanitizer wipes. This was really the first study that was able to look at actual healthcare claims because it was done in office buildings, in two office buildings, the building with a hand sanitizer program versus the control group. But done with an insurance provider, they could actually look at the cause of the reasons why sick people went to the doctor and prove that there was significant reduction. The next slide, I'll talk about some of the, before I talk about the results, I'll talk about the test methods. We can go to the next slide. The picture here shows the products that were provided at the desk. So each employee at their workspace had an 8-ounce bottle, hand sanitizer. We know that Pure Advance is a well-formulated, effective product, a strip wipe, and a small personal-sized bottle that they could carry with them. And then hand sanitizer was also provided throughout the workspace, especially in high-traffic areas, so dispensers on the walls, maybe by the elevator, in the cafeteria, food areas, by the coffee station, especially important in meeting rooms and break rooms. So that was provided. And then both groups, the intervention and the control group, got a little bit of training. This was really only a couple-minute video. It was not mandatory that they view it, but it was provided by human resources to both groups. So let's talk about the results. And I'm going through this very quickly, but this is a published study in the Journal of Occupational and Environmental Medicine. There's a lot of detail in there. Happy to take questions on it. If anyone wants a copy of it, I'm happy to share it. It is available open access to that journal. We found, again, like a lot of studies have in the past, that absenteeism was significantly reduced by over 10%. And then the really unique finding here is that visits to the doctor, healthcare claims, were significantly reduced by 24% for the group that had the hand sanitizer. Not surprisingly, but the first time measured, the employees liked it. So having the hand sanitizer program throughout the building, they really liked that. had a greater impression on their perception of the employer than many other things, like more important than providing an ATM, more important than providing coffee, things like that. And then we think it had an impact on habits and behaviors. That's what we're trying to do, provide solutions that improve our behaviors for hygiene. People self-reported in the study that they clean their space 40% more. And really important here is this was really normal use. We went in twice during the study and measured how much was being used. And on average, the range of hand sanitizer for the group of employees was 2 to 3 times per day. Now, there were some people that certainly used it more than that, and there were some that didn't use it at all. But the average was 2 to 3 times per day of hand sanitizer. People wash their hands 2 to 4 times per day, which is exactly what you'd expect in the normal course of the day. And the wipes were only used about 1.5 times per week, probably to help them clean their hands as well as their workspaces. All right, I'm going to pass it back to David now to take it.
Okay, thank you, Jim. Let's talk a little bit about some site-specific programs that Bunzl Cleaning and Hygiene spend a lot of their time in. First, we'll look at education and elementary K to 12, and some findings there have been very, very interesting. Post SARS, we've seen this ramp up in terms of the education piece in K to 12 with some really outstanding results. So, student absenteeism has been reduced by 51% when hand hygiene programs were used in conjunction to a curriculum that's been developed to teach the kids about good hand hygiene practices. And again, we've seen that grow and go through from the younger grades, certainly in SK and JK, and as they move forward and move on into secondary school, it's been outstanding, and they take those good habits with them. And again, that can consist of some short videos, educational pieces, and then good reminders, I should say, from the teachers at key times, lunch and snack time, and before, maybe assembling as a group within the education facility. So really good practices, and they're very bright, and they pick up on that. And then the key thing is to provide the students with the tools that they need to practice those good habits and getting those good outcomes. And a lot of it has making hand sanitizer available at key points, either on the teacher's desk, in the lunchrooms, in the public areas as they enter the spaces, tissue boxes, and again, teaching the children the proper way to cover their mouth and things of that nature. And then a biggie that we see, quite frankly, is hand washing supplies in the classroom at the sink, which a lot of times certainly in Ontario are at the back of the room, and encouraging them to use it. Another space where we spend a lot of time in cleaning and hygiene is certainly with higher education. And again, we want to bring those good habits forward. So installing hand sanitizer dispensers, in the dorm areas, in the bathrooms, in the dining areas where they have, a lot of people congregating, reinforcing the good hand hygiene practices by putting up education and posters and things of that nature to reinforce that. And of course, certainly, again, a very bright environment where the kids are looking for those things. And some of the great results we've seen a reduction in upper respiratory illness symptoms when good practices are followed, a total reduction in the illness rate, which is always a concern, because when it gets into an environment, it can spread really quickly. And then students, when the products are available to them, had a 43% reduction in fewer missed days, which is very important to keep the heads in the classroom and healthy. So, that's the education piece. Another area where we spend a lot of our time in acute and environmental, or healthcare environmental areas, they're facing some of the similar changes, and a lot of times they're every bit as critical, if not more critical. But they're facing challenges, certainly with increasing hand hygiene compliance. The Public Health Agency of Canada cites the following organizational barriers to hand hygiene: a lack of accessibility, which I know gets addressed constantly, inadequate maintenance of hand hygiene facilities, and poor access to products. So a lot of times we may be running low or running out and not getting refilled. And also, interesting, that a lack of role models and behavioral change a lot of times is driven by leadership and good role models and good practices are part of the culture that are created. The most common reasons healthcare providers don't perform hand hygiene are usually a lot of the time demands, workload demands, time constraints. The hands, interesting enough, they don't think they're visibly dirty. And as well, because of say an overuse of some products sometimes in their mind, they may find they have skin integrity issues, and that, people are not going to use the products when their hands hurt. So a lack of access to hand hygiene infrastructure where needed. And again, I know we deal with this constantly in our day-to-day to make sure there's adequate supplies readily available at all the key points. And I guess another stat that's come out of that is 10% of the patients in Canadian acute hospitals are affected by HAIs, right, the healthcare infections. And a lot of that is a result of maybe poor hand hygiene practice. And so, we can't look beyond that, and that's why we're looking for more consistent outcomes. There has been some development, in terms of hand hygiene healthcare. There's some actionable tips. We've developed a hand hygiene toolkit. This is through our friends with Alberta Health. And ensure teams have tools for success, products, infrastructure, and a good hand hygiene initiative. The staff identify where they're going to need those dispensers and placing them as part of the process, and then placement of the dispensers in the key area. And you're helping to create a culture of hand hygiene with really good outcomes. And again, what it's done, it can influence the compliance by upwards of 70%. And again, Jim touched on it earlier, but the data is critical, and you need to share that data if you're going to drive that behavioral change. You can do that a number of different ways that we have listed here. So, having said that, I'm going to turn things back over to Jim for the next portion.
Thanks, David. I'm going to talk to you now about setting up your hand hygiene program. If we go to the next slide, what we've done for you here is taken literally thousands of pages from guidelines, best practices, recommendations, and public health hygiene guidelines. Like I mentioned before, in this large body of evidence, there's a lot of studies that show what works. And we summarize them here for you simply. You need to have some degree of a good culture around hygiene and infection prevention. It usually starts with some support from senior leadership, providing the right resources, having high-quality products that actually work, and then just making it part of your culture. And in some cases, you've got to build in processes, so allowing people to not come to work sick so they don't propagate illnesses and practice what's known as presenteeism, coming to work sick and risking others getting sick. Really critical, for instance, in food service. So in a restaurant, a sick employee is often the cause of outbreaks and illnesses there. So having a program to prevent that is important. Providing education, training, and feedback. As I mentioned before, it doesn't have to be a lot. Just a little bit upfront so they know the importance of it, and they have reminders that I'll mention in a second. There's other things that are important, like effective coughing and sneezing practices, using tissues when you sneeze, throwing away dirty tissues. And, it helps if the group around you provides some feedback. When someone does it well, or if they practice poor hygiene, you want to mention that to them as well. You got to provide products that are likable, they're well tolerated, they're safe, they're not going to damage your skin. I'll talk about that in a minute. And put them in the workflow. Ideally, on your way, for instance, to getting food, on your way out from the coffee area, near the bathrooms, of course. So having them in the workflow at the right moments so you can clean your hands at key moments is really important. And then some reminders in the workplace. Oftentimes that's posters communications, maybe an email occasionally, is also important. It doesn't have to be a lot. If we go to the next slide, let's talk about some key things about washing your hands. You don't want to do that, what we call the splash and dash, the 1 second, rinse your hands with water. That's not going to remove or kill the germs. So apply the right amount of product. I know with Purell products, put a lot of thought and testing into how much is needed to get the right level of reduction. So use the right dose, use the right volume. Touch-free systems are great because they give you the absolute right dose. You don't have to rely on the person to decide how much to use. After you put the soap or a sanitizer on your hand, you want to rub it vigorously. If it's soap with wet hands is preferable, then I will lather up and lift the germs off the skin. When I cover the whole hand, especially the fingertips, the fingernail areas can be a source of more organisms, more pathogens. You want to use comfortable water. We say warm water here. There's studies that show that hot water is not better. So that's a myth. You don't need to use hot water to clean your hands. If it's more comfortable, you're more likely to wash your hands longer. And the longer you wash your hands, the more germs you will remove. Dry with a clean paper towel. I'm not an expert on this, but I know there are many studies that show that a paper towel is better than the hot air dryers. Less risky, less risk of germs getting around the environment, and also the towel will remove some germs from the skin. And then you want to, if there's the door handle, try to use the paper towel to open the door and then throw the towel out. So reducing your risk points. It's really all about risk reduction. So the next slide, I want to just remind you of the importance of healthy skin. So it's really important to use products that, as I mentioned, are safe, effective, and good for you. And a key part of that is not damaging your skin. So it can be, if it's poorly formulated, it can be harsh. So you want to make sure the products are well formulated and not going to damage your skin. We know with hand sanitizers that are well formulated, you can add ingredients like glycerin and other emollients and skin conditioners. And there's studies that show that hand sanitizing can be, if it's well formulated, milder than hand washing. And hand washing can be damaging. You not only have the water exposure, but you have friction. Hand lotion is really important, especially in cold winter months where low humidity, cold weather is proven to damage the outer layers of the skin, the stratum corneum. So a hand lotion a couple of times a day, maybe right before work, right after work, right before bed, after waking up are key places, key times where you can moisturize your skin and reduce the risk of it getting damaged and cracking and cutting. And in the hand sanitizer, you want to use that dose that will keep your skin wet, the wet feeling as you're rubbing it for about 15 seconds or so. All right, I'm going to pass it back to David to talk about choosing the right product.
Okay, thank you, Jim. And I think Jim's touched on most of this over the last 3 slides, and this is where our good friends and partners at Gojo and Purell are leaders in formulation and putting out the products that are going to perform and give us the best outcomes, certainly with their 70% alcohol content hand sanitizers. And as Jim touched on, not necessarily going to strip the moisture away from the skin and provide, an irritation issue. And again, dispensing is critical in the right places and making them accessible. And as Jim touched on with the touch-free technology that they developed so extensively, it gives you the right amount every time, and that's a critical piece. Something over to something they're very close to me every day is let's talk about disinfecting. And again, we spend a lot of time educating our client base and people on the differences between cleaning, sanitizing, and disinfecting. And and it's all critical to stop that infection with the right cleaning procedures and the right tools. So using the right equipment, certainly make sure that your disinfectants have it in. And again, more often than not, looking to get at least a sanitizing claim of a 4-log reduction, and so we can deal with these viruses. And again, one thing that we see emerging all over in all kinds of sectors, especially in education, is color coding tools and cloths to avoid cross-contamination and spread. Critical piece of this as well always is to reinforce the training and develop that culture where everybody understands the tools and how to use them properly. And then again, if you need this to look at this, we're always available to help you consult at Bunzel Cleaning and Hygiene on getting you the right information to make those constructive decisions moving forward. As I say, it comes a time too, as we enter into the cold and flu season, that also the cleaning and disinfecting may have to be ramped up, and we want to focus on certainly cleaning for health, but as well for appearance. So we might have to increase frequencies and use some other tools to augment our program, and as we enter into this season, and make it's a good practice to make some of these supplies available to the staff so they have some ownership of this at their own spaces. And disinfectant wipes are a really good tool for that, as well as some of the newly developed multi-surface disinfectants that Purell have come up. They've got some really innovative solutions, and they are highly effective in a very short period of time. So having said that, that concludes our slide portion of the presentation. You will be receiving, as it was mentioned, a copy of the hand hygiene here for guide for attending today. And as well, we're going to be sending along a special offer on our Purell ES system, and we're prepared to take some questions.
Great. Thank you, David and Jim. So we're going to move over to our Q&A session now. If you haven't had a chance to enter in your question, please just type that into the little speech bubble icon at the bottom of your screen. But our first question here, we have, are there supporting materials to train staff on proper hand hygiene techniques?
Okay, it's David, and I can answer that. That certainly Gojo and Purell have developed a lot of supporting documentation that help to drive the behavioral change in education in a proper hand hygiene program, and we see it in a lot of the different sectors that we work in every day. And again, that's going to be covered off rather extensively in our Bunzel hand hygiene guide.
Great, thanks. Our next question, what additional areas should I look at when choosing a surface disinfectant?
I would say you want to hit a safety profile and food and contact safety as well. This Purell surface spray really supports that and would give that, and it has all those key elements we talked about earlier, the DIN and the appropriate kills in a relatively short period of time, and that makes it a very effective tool.
David, I wanted to add on to that a couple other things when I think about choosing the right surface product. Is you want to look at what organisms they kill and what the contact time is. So that surface spray that you mentioned has a 30-second contact time for norovirus and 60 seconds for hepatitis A. And that may sound long, but that is way shorter than many products out there. Most products will say 5 minutes of contact time, and some even say 10 minutes, which is really not feasible, not practical. So look at those organisms and the contact time, and then you've got to make sure that they're compatible with the surfaces they touch. Bleach is awesome at killing germs, but it can also cause damage on surfaces. You want evidence of that compatibility, and it's ideally going to be safe even on a food contact surface with no rinse required. That would be the best, because that's saying that it's so safe that even if you leave it behind and then your food touches it and you eat it, you're at no risk.
Okay, our next question. Any recommendations on wearing wedding bands?
I think in healthcare settings, it's recommended to not wear jewelry on your hands. But in all other settings, I don't think it's a problem to have rings or jewelry. It's more important to clean your hands at key moments. So right before you eat something is really a key moment, and whether you have germs on a wedding ring or no wedding band on, is not really going to make a difference in that case.
Great, thanks. Our next question here. How can you tell if there is a cold and flu outbreak in your workplace?
That could be a really loaded question. An outbreak, largely when it occurs, is when there's an increase in the number of cases more than traditionally would be in that environment. And this varies depending on the population and the area you're in. For an example of that, a couple of cases of flu in a long-term care home within 48 hours is enough to be considered an outbreak. So again, it'll depend on the sector that you're in, but that to say it's an increased amount of activity in terms of people being ill.
Yeah, and I think I would add to that you can see that when people are sick, and if you're concerned about the number of sick people, call your local public health agency, and they're the ones that officially determine whether it's a quote-unquote outbreak or not. But if you see sick people, that's a great time to improve your hygiene practices, maybe more reminders in the workplace around the importance of hygiene. You might even want to put out some extra samples and products so that people are reminded and have more access to the products as well.
And when do you recommend using a hand sanitizer over soap?
Yeah, I'll start on that. I think when you're on the go, in a space where it's maybe inconvenient and you don't have the time to go to the sink and wash your hands, that's a great time for it. An example that comes to my mind is a cafeteria setting in a school or even in an office, a large cafeteria. If you're in line to get your food, that's a great time to hand sanitize, right after you've gotten your food. Most people don't take the time to go wash their hands, even if they know that it reduces their risk. So when it's convenient, and you obviously need to make sure that you have a product that works. So I know with Purell products, we know they're going to work. David, did you want to add anything?
I would just reinforce that hand sanitizing, it's critical, but it's not a replacement for hand washing. So always when you're in a position to wash your hands, it's the best case scenario. And really, hand sanitizer, as Jim pointed out, it augments the hand washing process.
Is it true that hand sanitizers help create superbugs?
Oh, I'll jump on that one. No, it's not true. That is a myth and misperception. This idea of superbugs or super germs, infectious disease, folks would call that resistant organisms, antibiotic resistant organisms is where that comes from. It is proven that overuse or misuse of antibiotics can cause some resistant organisms. One that most people know of is MRSA, methicillin-resistant Staph aureus. That was mutated from use of methicillin, which is an oral drug. Hand sanitizers or hand washing or surface disinfecting, there's no evidence that will cause resistant organisms. And there's some great education materials on the CDC website, Clean Hands Count, and they talk about the fact that hand sanitizers do not cause resistant organisms or super germs.
Great. Are there non-alcohol-based hand sanitizers available for use in healthcare?
I can start on that one. It's strongly recommended by all the public health organizations to use an alcohol-based hand sanitizer in healthcare, and that's because the evidence is so much stronger that they really kill a broad spectrum of germs, including cold and flu, quickly. Now, the one place where non-alcohol is often considered is in psychological units or mental health wards, where there may be more of a risk of a patient doing something with that alcohol that's not good for them, such as ingestion or other things. So that's the one spot where you see some non-alcohol in healthcare. If you're considering a non-alcohol product, I would make sure you really read that label and look hard at the performance. Many of them say they're effective, but they don't have data to support that.
Jim, I would just add too, we see traditionally some of that too in the penitentiary and the federal penitentiary environments where they initially had tried to use quat-based hand sanitizers, and as you mentioned, they're not proving effective tools. And in Ontario here, certainly the Ministry of Health and the Ministry of Education are advocating isopropyl alcohol only. So they're not strong supporters at all of alternative hand sanitizer, the quat-based products.
David, just one clarification: isopropyl alcohol and ethyl alcohol, they're both good active ingredients. We tend to focus more to look at the Purell products that have ethanol in them because it has less smell. And if it doesn't smell bad, it won't turn people off to using it again the next time. The sensory experience, I didn't hit on this much, but the sensory experience is really important. If people don't like the smell or the feel of the product, they're not going to use it.
No, and that's very valuable. Thank you for that.
Okay, I think that might be all our questions. If anybody has any other questions that come up after, please feel free to reach out to us. I want to say a big thank you to our presenters, David and Jim, and also want to thank everybody who attended today to learn more about hand hygiene programs. As mentioned, everyone will be receiving a recording of this presentation and a copy of our hand hygiene programs guide. And as a special thank you, you will also be receiving a special limited time offer for the Purell ES8 touch-free dispensing solution. So please watch out for that in your emails. And so now that concludes our presentation. Have a great day, everyone.